Hey, good afternoon, everyone. Can I get everyone's attention? Good afternoon, everyone. My name is Sipes Lengwaniso. I'm a lecturer and biokineticist at the Human Movement Science Department. So just to welcome everyone back and everyone online, we'll be continuing with our last session for today. And I hope everyone is feeling refreshed and that you've enjoyed the lunch and we can continue with our program. So the first speaker for the afternoon session will be Ms. Bavuma, our Faculty of Health Sciences librarian, and she'll be taking us through all the resources that we need and how we can source this out from the library. As Ms. Dinane said, that she is the person you go to when you want to find something and you're struggling on your own. So please let's give her a chance to give us more information. Thank you.
Good afternoon to those who are here in person and those who are online. As Dr. Ngoniso has said, my name is Nobuzwe Bavuma. I am the health sciences librarian. I am mainly based at South Campus. So for today's presentation, I wanted to talk about, Okay, sorry about that. I just needed some assistance. Okay, so as I was saying, okay, so these are my contact details for those of you who might need assistance. So if you need to make an appointment with me, but there is also a booking system which I will share with you on how to go about and finding me. Okay, so the content for today, I'm going to talk about the library membership, the library website, which is very important, where you will find the resources. And I'm also going to touch on the evidence synthesis research, which is actually quite spiked within the institution, and also what is my role within that, and also assisting you in finding the ebooks, which will come in handy, especially for those students who are actually not based in Gqeberha, and also the online databases where you will go and find your online journal articles, and also the EndNote reference tool, which is very important, and I encourage quite a lot, especially for postgrad students, and also the publishing support. Okay, so for library membership, okay, so you need to have your student card. So for those who will be visiting our libraries physically, we do have a security that is stationed at the library entrances who will ask for your student card. And also, in order for you to be a library member, you must be in order for you to be able to make use of our library resources off campus, you must be a registered library member. And then we create a PIN for you. So for those of you who are not in Gqeberha, or for instance, who are not attending classes, please make sure that you contact me, email me your details, so which means will be your address, your contact number. Then I will create the PIN for you in order to access our resources from off campus 24 hours, 7 days a week. So you don't actually need to be within the campuses. And then also by creating a PIN, you will be able, as I said, to access our online databases from home, and also request items from the interlibrary loan service, which I will explain a little bit about that, and also activating your reading history. So the activation of the reading history is basically once you take out books in the library and you return them on the system. Unfortunately, we are not able to trace back which books you've taken out when. But once you've created your library profile online, you will be able to trace back. Let's say, for instance, you take out books now and then you go back months later, you want to take out, want to know which book you took out, let's say in March, you will be able to do that. But for us to go to the library system, we won't be able to do so. Okay, so for the borrowing rights as a master's and doctoral students, you are allowed to take out about 20 books for a period of 60 days. We also do have a service for students who are outside Gqeberha. If there is a book that you've searched on the catalog and you see that it's available, we do actually courier the books to you, but then the cost will be on you to courier those books back to us, okay? So we do have that service for the postgrad students, and also you can renew those books via the phone, also the classic catalog, as well as in person. You can do so twice, but say for instance, you try and renew a book, you see that it's not allowing you. It could be that it's reserved for another person, okay? So if it's reserved for another person, you will get a notification to say you are unable to renew those books. Also, sometimes there is a fine. So if you do have a library fine, you will also not be able to renew those books. And then if I'm talking about the interlibrary loans, so most of the time when you do a search, you might come across journal articles which are not, you are not able to access the full text on that. And if it's very important in your part of your research, what you can do is you can email me the details of those journal articles, or even if it's a chapter of the book, of an ebook, you email me those details. What I'll do is I'll send it to our interlibrary loan office. They will probably source it from another institution at no cost for you. Okay, so that is what is interlibrary loan. So if you do a search, you see that you are unable to see or access the full text of that article. What you can do is you can email me the details, even if it's a chapter from an ebook, and then we will, as soon as I get the notification that that article is available, I'll probably email it to you at no cost for you. And then the library website. Okay, so the library website is the getaway to find the relevant information. So we do have important links to remember. So the classic catalog will be the one where you go and search for books as well as the ebooks. Okay, so all the information that we have. And then the online databases will be where you find your journal articles. And then also the Google Scholar. Google Scholar is just a search engine. Google Scholar is also linked to our own databases. So sometimes you'll see that when you click on the Google Scholar or on an article that is available on Google Scholar, it might take you through to, let's say, for instance, on Science Direct or EBSCO. Okay, so hence why we encourage the use of Google Scholar. And also the publish support, which I will speak about later on what it is and how it can assist you. And also the library guide, which we call the lib guides. And then at the bottom, you will see our URL, which is library.mandela.ac.za. Okay. And then this is the interface of the library. So they will see there the Find Plus, where you can do a search for articles, as well as the books, as in ebooks, the classic catalog. So this is just our interface. Okay, so we've actually developed a system where you can make you can book an appointment with me. Like for instance, today I'm out of office and you'd like to make a booking. So if you click on the book an appointment on the library homepage, then as you will select a staff member, obviously you will select the Library for Health Sciences. There is an option for the location. So it's either it can be South Campus, it can be North, as well as the MS team. So whatever is comfortable for you. So if you like to come and see me face to face in the office, there is that option where you can select South Campus, or if you would like to make a booking where we can have an online meeting, there is also that option available. And then you will see that the dates available obviously will not be highlighted, and also the time frame. So I like to start my meetings at 9 o'clock because sometimes even though the library opens at 8:30, sometimes we do have a meeting in the office. So my bookings would normally start at 9 o'clock up until 3:30 because I knock out at 4 o'clock. Okay, so you can also do a booking there. Okay, so I've spoken about the library databases. So I just want to talk about the letter of introduction and what it is. So students who are not in Gqeberha, who are closer, let's say, for instance, they are in Johannesburg, they are closer to Wits University, or they are closer to University of Johannesburg. So there is an agreement amongst institutions where, for instance, we give you a letter of introduction, and then you can go to Wits University, give them that letter to say you are a Nelson Mandela University student, you would like to make use of their resources. Then once you do that, present them with that letter, obviously the services won't be the same as your home library, which is Nelson Mandela. All the terms and conditions will solely depend on them. I know that with us, if we do have a student from another institution, we only allow them, I think, 5 books for a shorter period of time as compared to you guys. So the terms and conditions on how you make use of those libraries solely depends on those institutions. So we just give you an introduction of letter. So you'll go to the website under the useful links. There is a form there. Okay, so this is the form that you will fill in. So you will say application for a letter of introduction to the University of, and then you will say University of Johannesburg or University of Witwatersrand. Okay, so if it's more or 2 or more, you will fill that in at the top, and then you will say your surname, and then obviously your name, and then the year of study will be this year, and then you will indicate whether you're a master's or doctoral students. You fill in that form for us, and then you sign it at the bottom, and then my colleague will make that letter for you, and then you can go and present it to that particular institution. And then the LEAP guides. Now, the LEAP guides were actually created for students. There are a lot of presentations that we do throughout the year. So sometimes it's better to have a referral where you can go and practice for that. So we do have quite a lot for the APA style. If you would like to know how to go about doing that, we do have it. So for EndNote as well, because today I'm only given an hour, I won't go deep into how to do or install or how to use EndNote. So there is a guide for you there, and also how to find information, where to go, how to use that information. You will find it there. And also the SAGE research methods. The SAGE research methods also have quite a lot of research books, current research books. So that is also where you can go and find the research books. And then we've got the what we call the digital commons. So this is where our thesis and dissertations from our previous students as well as the researchers are actually placed. We share this platform with other Eastern Cape institutions. So if you go there, so if you click on the digital commons, then it will take you to this site. It's either you just want to search if your topic has been done already here, or you know the particular author of that research. What you can do is you can type in the author's name, and then this is the screen that is going to come up. And then where it says the creator, then this is the author. Then you can select that particular author, and then you will see the example there. Dr. Abdullah has two, which is the master's and and her PhD. Then what you can do, you can go and select the one that you are looking for. And then there's a download button at the bottom there where you can actually download her entire PhD. Okay, so you do have access to this research for you. And then I want to talk about the evidence synthesis research. And I've seen on the program that Dr. Velma will also be touching on this for the scoping review, as well as another one, which is the systematic review. But I wanted to touch on this point because it's something that has come up quite a lot with the students. And I feel like it's the students I feel have are either given little or no guidance at all on how to go about this. So this is the new, I would call, phenomenon in the institution. And students come to me and they're not quite sure on how to go about this process. So the evidence synthesis actually talks about the processing of bringing together information from a wide range of sources. And I wanted to bring this because it's quite different from what we would call your normal literature research. There's a systematic way, or there is a methodical way on how to go about this. And I've seen students who come to me thinking that it's just a simple, quicker process, and it's not. This is more comprehensive. This is time consuming. I haven't spent an hour or less than an hour with the students going through this process. And I just wanted to make you aware of what is involved. Obviously, it's such a short period of time. I won't be able to go into too much detail about it. But the most important one that I wanted to highlight is that with the evidence synthesis, that you approach with a formulated research question in a methodical and comprehensive way. The other day, I received a request from a student to say she's doing a scoping review and she wanted to send me the keywords. It doesn't work like that. We're not doing the keywords. When you do a scoping review or you're doing a systematic review, what you need to understand from the top is you are answering a research question. And when I say that it's not an easy or a quick method, is when we do, okay, so let me just, okay, so these are the types of evidence synthesis. So the first one, it's the narrative literature review, which is our normal search review. And then we've got the scoping review, which is topic-based, and you are just mapping the evidence. Then we've got the systematic review and the rapid review, the integrative. So there are different, this is just some of them, because there are a whole lot more of them that are available. Okay, so my role when it comes to that. So when I talked about with the systematic review or the scoping review, and I say I assist with the development of PICO or the PCC statement. So when you give me, or you are approaching me to assist you with the scoping review, you must have a formulated question. Because with that formulated question, we have to then develop it into a PICO, which is the population, the intervention, the comparer, okay? Or if it's the scoping review, we use what we call the PCC, which is the population, the content, as well as context, okay? So hence why I said, once you approach me with that, please don't give me your keywords and say these are the keywords. It doesn't work. And also from that question is, then we have to develop or determine the terms and the logic of that question to use the Boolean operator. And also with this, we have to develop what we call the search strategy as well, because with the systematic review or the scoping review is, once you've developed a search strategy, you have to use that search strategy across all the databases that you would have said you are going to use. Let's say you've selected about 5 databases. You have to use the same one, same search strategy. Obviously, you will have to make changes because sometimes the databases work a little bit different. Sometimes the character works a little bit different from EBSCO to Science Direct. And also, assist you with the selection of the databases. Like for instance, if you are doing something on mental issues, then I would say, how about using PsycInfo? Because PsycInfo is also one of the great databases that you can use. How about using Scopus, which is another database? On EBSCO, we don't just say we're going to use EBSCO, and then there's still a database that you still have to select within EBSCO. Then I will say, let's rather use Medline, or let's rather use Sinal within EBSCO host. And then also I assist you with the reference management tool, which is the EndNote, and also the emphasis on the documentation process. Because remember, with the scoping review and systematic review, it has to be transparent, it has to be replicable. So if you take that strategy and you give it to your supervisor, they have to take that same strategy and go and search and possibly get the same search results. And also what I want to emphasize is, once we've developed the search strategy, I would probably do the 2 searches on 2 databases. And then I will give you the feedback on what I can find. I don't do the selection or the screening of the articles. I give it to you to engage with the literature. If you see the results are probably more or less what you are looking for, and then that will be great. Then we'll probably stick with that search strategy. But if it's not, then it means then we will still have to consult and sit down and look at what are the terms that are still missing from the search strategy. So it's never a once-off. There's a give and take. There's more consultation, as long as the search results or the results are not matching to what you are looking for. Okay, so it's never a once off. Unlike when we are doing our normal literature review. Okay. And then finding the ebooks, which will come in very handy for those who are working off campus. So where do you go? You go to the classic catalog to find the physical books as well as the ebooks. Then we go to our search on search more options. We go to the advanced keyword. And then you can either type in the title of the book, or you can just type in your topic, whichever way. But on the material type, then you select the ebooks just to make sure that you are refining your results. And then you will see only the ebooks results you will see there. And then what you need to do is, then you select the title of the book, and then the NNM user link to Sage Research Methods. And there is your ebook available. And the nice thing about this is either you can download the entire book, but it doesn't mean that it's going to stay with you. There is an e-issue It's either for 21 days or 7-day period, depending if the book is on demand. We do evaluate the issuing of the ebook. So it could be 7 days, it could be 21 days. After that period has lapsed, the ebook will go back to the system, and also the licenses of the ebook. It depends on the publisher. So sometimes we do have books that have unlimited user, which means this entire room can make use of that book. Sometimes the publisher will only have it one license, which means if I am currently busy with that ebook, it won't be available for another user up until I am finished with that book, then it becomes available. And also the nice thing about an ebook is you can just go straight to that chapter that you are looking for. So if I'm looking for something on the ethics and cultural competency, I can just go straight to that chapter, and then I will be able to open up or download that chapter. And then we go to the online databases. As you see there at the top, it tells you that for off-campus access to such databases, you must be a registered library user, and then you will need the library barcode as well as the PIN. Now, we've got lots of databases that we have on the screen, but I thought, let me just make it easy for you for health sciences students, which databases are normally used quite a lot. So it's EBSCO. The PubMed is quite available freely. And then the Subnet Online, it's only our South African database that we have on that list. And then the SAGE journals, and then the SAGE research methods. This is quite an important database that I'll normally use. Also say to students, if you are on the planning stages of your research, this is actually quite a nice database to make use of. And then Science Direct, Scopus, Taylor and Francis, Web of Science, and then we have what we call Press Reader. So for those who like to read the newspapers or magazines from around the world, then you can just go and read there. And also, of course, the Google Scholar. So this is just an example of the research, of the SAGE research methods. There are books as well as the journal articles, and sometimes there are cases that are available for students. So if you are looking for research books, qualitative, quantitative, all types of books, what you can do is you can come and search for the latest books that are available here. And also under tools, and then you will find also the project planner. So all of this is defining a topic, literature review, developing a research question, research design, research ethics, data analysis, writing up, and the dissemination. So all that information is available under the SAGE research method database. And then we come to the EndNote reference tool. I'm not going to go into it too much because on its own, EndNote takes about an hour if I had to do the installation and also showing you how it works. So if you need assistance, you can just make a booking, then I will assist you on that. But this is just to make you aware that we do have a reference tool which is supposed to assist you on managing your bibliographic reference, which makes it easy for you that you don't have to actually manually type in your reference or your bibliographic referencing. What you can do is you can also export referencing from the databases as well as Google Scholar. And also it has a plug-in with the MS Word for inserting a referencing, Where you can go is to download and install that. You go to the library.mandela.ac.za, and also there is a guide for you on the lib guides on how to do, on how to go about doing that. Okay, so it organizes and formats referencing and streamlines the citations. Okay, so this is just an interface. I wanted to show you the interface. So these are all the referencing or the citations that I've actually exported from either the databases or Google Scholar. And then if you had to create or insert that in my MS Word, once you've downloaded EndNote, when you open your MS Word, you should have something that says EndNote 20 there. And then what I can do, if I want to put it in on my documentation, this is actually how it's going to sit. And it's nice because it develops alphabetically for yourself. You don't actually have to develop make sure that it's in alphabetical order. Okay, so this is just to assist you. It makes life so much easier than having to do that manually. And then the last one is the publishing support. So the university, in fact, all the institutions in South Africa, we have a body which we call the SANLIC. SANLIC actually negotiates for the libraries with the publisher if we want to purchase it's either databases or the journals. So they do a bulk negotiation, which we normally get the discount from. So the transformative agreements, so it allows people to publish on the open access. So it assists the researchers as well as emerging researchers with the charges. We know that publishing is very, very expensive and it normally comes in dollar signs. So with the agreements, it allows you to publish at no cost, or sometimes if there is a cost, there is a discount on that. I will just show you how to go about doing that. But in order to be eligible for that, you must use your NNMU email to show that you are affiliated with our institution. Please make sure that you don't use your personal emails. So how do the agreements factor into selecting a journal? So you assess the quality of the identified journals. As you know that there are lots of predatory journals out there. So that with actually having these journals under our agreements, you are guaranteed that you will be publishing in established journals. And also sometimes on the library website, we do have the DHE journal accredited list if you would like to know which journals to publish. And also you must check the current transformational journal agreement in order for the article eligibility. And then you can select the journal, a preferred journal, and then you submit your article. Okay, so currently we have about 9 agreements with as an institution. All of them have their own business model. So it's not a one size fits all. All of them have their own. So we've got an agreement with American Chemical Society, Cambridge, Emerald, Oxford, Royal Society, Sage, Elsevier, and Spring and Nature. So I just want to show you how to go about doing this. Okay, thank you. Okay, so this is a library website. So if you'd like to know more, what you'll do is you go to publishing support. And then what you can do is, just as an example, you'll click on the ELSA field. And then you can get the full title. So if I go under here, and then these are the titles of the journals that are under the agreement. And also what you need to note is there's a hybrid model as well as the gold model. With the gold model, sometimes, not all sometimes, but all the times, what you will do is there is still a fee that has to be paid, but it's not sure. Okay, sorry about that. Okay, so with the gold, it is still included under the agreement, but there's still a fee that has to be paid. So you'll only get a discount of 15%. But if you are opting for a hybrid model, there is no charge. You will see there, it's part of the agreement, but there is no charge there. So what you need to do is, just as an example, okay, so I will just take this model. So this title of the journal. Then you go to the website. So the submission of the manuscript, it's still the same. It hasn't changed. The only thing that's changed is when you do the final submission. Okay, so when you actually do your submission of the journal, the only difference is in the payment method. You will select the one with an agreement on, and also make sure that you put in an email address. Once you've put in an email address and they've received it, we will get a notification as the library to verify the details if you are really affiliated with an institution. Once that is approved, then and your article is accepted, the chances are, as Prof. Melarire has shared with me, she was able to get her article accepted at no cost to her. So that is the support that we have for emerging researchers, as well as the researchers for our institution. Otherwise, I am done with my presentation, and thank you so much. Any questions?
Thank you very much, Ms. Bavuma. Very enlightening presentation. Are there any questions on the floor? Any questions? Do you have any questions online? No, there's no. Is there a question online?
Okay, it's not surprising why you're not asking questions, because I think Ms. Bavuma is basically talking about publications, and you may be wondering, you just want to do your proposal and now they're talking about publications. But honestly, it's something that you can actually do even before 6 months' time. And I tell why I'm saying that. Let's take, for instance, that you engage in a scoping review or a systematic review. which obviously you will be actually showed how to do that in the next couple of 2 days, like tomorrow, or is it in the program? You agree with me that when you have completed your literature review, even before you start your data collection, you can actually publish that. And it is to your credit, I promise you, if you are submitting your dissertation or thesis to be examined and you have an article published, which you have indicated or included in your submission. So your literature review, if done the right way, systematically via scoping or narrative, could be published. So this information will be vital in the next 6 months if you want to take that route. And I encourage you to. Okay, thank you.
I also agree with Prof. It's a very valuable opportunity from the university, allowing us or the students to be able to publish free of charge or at a discounted rate. If there are no questions, I have one question for you, Ms. Bavuma, regarding students that are not based in Gqeberha, that are maybe closer to another university in a different city. When they do approach the university, obviously with the letter, do the other libraries at the different institutions charge a fee? Like, are there any cost implications for that?
It depends on the institution itself. For us, I think there is a fee. I think it's 250 for 6 months. I think it could be 500 rand for a year. So it depends from institution to institution. Hence why, as I said, all the terms and conditions solely depends on that, because for us, even though they are a master students, we only give them 5 books. We don't allow them to have access to our online databases. We encourage them to use their own home library for that. We only allow them, to come and take out books. Yes.
Thank you very much for that answer. Because I'm thinking that if someone is going to access another university, they'd maybe want to know if they would have to pay. But based on how much you charge at this university, I'm hoping it's not like a lot of money. Yeah. And then, okay, we have one hand up online. Okay, sorry, before I go online, there's one question on the floor. Sorry, just excuse that.
For me, just a clarity-seeking question, because more of a follow-up on what she just asked, because earlier on when you speak about other institutions, you only reference to VETS and UJ. So I'm wondering if this agreement is only VETS and UJ, or does it apply to any institution in the country? And then number 2, in terms of, because I feel like the information that you're giving here, actually, you said most of them you couldn't really give now because of time. So I think in terms of contacting you, I'll be more interested in your contact details.
Okay, thank you for that question. It applies to most of the institutions. We do have an agreement with probably all of the institutions, Cape Town, all the institutions there, even here in the Eastern Cape. So this was just an example that I was just making, for people who are in Johannesburg. So obviously, if you are here in the Eastern Cape, you are closer to Walter Sisulu or Rhodes University. Yes, we do have an agreement. If you are in the Western Cape, we do have an agreement with Stellenbosch, UWC, CPUT, all those institutions. Yes.
Okay, I think we can go to the person online. You can unmute and ask your question.
Okay, thank you. Thanks, Ms. Bavuma. You always really assist and always going beyond the call of duty. I just wanted to check. In your initial presentation, you said we need to create a PIN each year. So I'm not sure if I'm following every year. Should we be requesting a PIN to access the library services? The second question, in terms of accessing library services from other universities, maybe this is not the correct platform, but it is quite maybe just a future request that more services are offered, because when we get these library accesses, it's basically just to use the library and take out the hard copies. We don't get access to request ebooks. We don't even get access to use the segregated masters and PhD students library areas. So I'm not sure if maybe there can be other strengthened services or improved services that can be offered to PhD students at other universities. Thank you.
Thank you for that question. For the postgrad students, their record are almost going up until April. So if you were registered last year, your record will probably expire this year, and then you will register, of course. It shouldn't, but if sometimes there is a problem, what you can do is you can contact me. I'll reset that PIN for you, and then you can be able to access that email. So for those who will be starting this year, once we've set up your PIN, it should last you up until April next year. But sometimes I know that students will encounter a problem. So you're more than welcome to contact me anytime with that. And in terms of the resource part of it with the other institutions, as I said earlier, also, we only allow students to take out books. We don't allow them to access our databases. This is because all the institutions are paying for these databases. Hence why we're requesting that students register and then have a PIN, because we don't want anyone to just have access to our databases. So I think the same institutions are applying the same thing. And also that's why I also highlighted the fact that you can also access our own ebooks in the institution. Also, but if, for instance, we don't have a resource, then we will use that service, which we call the interlibrary loans. This is just something, this is an agreement that is standing at the moment. Only the directors of the libraries of the entire institutions in South Africa can only discuss on that level the changes that needs to be made. But as of now, this is just to assist students, but the main library, which is your own home library, should be able to assist you, even if you are in Johannesburg or wherever you are situated. Yes, thank you.
Okay, no questions from the floor. Okay, if we don't have any more questions, thank you so much, Ms. Bavuma. This was really informative. And as Prof. Mallory said, some of the things may not apply to you because you're still in the initial stages, but I can assure you that you will definitely need her services. You'll get to understand about the publishing and all other things she mentioned. And one thing that will apply to all of you, even now in this beginning stage, is the referencing engines. So your EndNote and your Mendeley, those are very important. I cannot stress that. Type manually all your references, because you will make mistakes, and that will be a big thing for your proposal. So please do try download it as soon as possible. Try to navigate it and understand how it works, because it will definitely benefit you still from your proposal stage all the way to the end. Okay, thank you again. Okay, so two of our presenters are running a bit late, so we will jump to our fourth speaker, Dr. Mpho, who will be taking us through all the cutting edge research that is being done in our health sciences faculty, and his focus is on nanomedicine. Thank you so much, Dr. Mpho.
Okay, thank you, Chairperson. My name is Dr. Mpho Mwebe. I'm based at Mission Valley campus. I'm the researcher with the DSI Nelson Mandela Research Group. So for today, I'm just giving you guys a little bit of introduction into our research group, which is based at Mission Valley campus, part of the medical school. So for our research group, we just focus mainly on nanomedicine. So Seems like this thing is not moving. Okay. So for this presentation, I'm just going to give you guys a little bit of introduction, what is nanomedicine. Because I'm sure you guys are coming from different disciplines and some of you guys might not know what is nanomedicine. And then I'm just going to give you guys a little bit of overview of our research goals, current projects that we're working on, the equipment that we currently have, and the research team that is actually existing, and also our contact details for those people who want to actually do research with us. So a little bit of introduction into what is nanomedicine. I'll go back into what is actually nanotechnology. So as you can see from figure 1 there, you can see there we've got your tennis ball. Everybody can see the tennis ball with their eye. And then you've got an ant, can still see it with your eye. And then you've got red blood cells. With red blood cells, we know you need a microscope in actually to see the red blood cells. So the scale that we're actually operating at is the scale of a virus. So at the scale of a virus, here we can actually change the properties of the material that you're working with. So anything from the size of a glucose molecule to the virus, that's the materials that you're working with. So the advantage of working with materials at that scale is that we can actually have more surface area, and then you can also enhance some of the properties of the materials that you're working with. So I'll just give you guys an example of different application of these nanomaterials that have been used. So as you can see on figure 2, some of these nanomaterials have been used in cosmetics. I'm sure you guys have applied some sunscreen before. Go to the beach, we stay in PE, so I'm sure you have to use some sunscreen. So basically some form of sunscreens, you actually have some titanium oxide and zinc oxide. Some of these materials are actually at a nanoscale. So these nanomaterials are actually help you to prevent any UV damage to your skin. And also for the ladies in cosmetics, we also have some gold now that is actually put into your cosmetics. It helps with anti-aging. So this is some of the application of nanomaterials in cosmetics. Some other applications can also be used in textile, where you can actually have clothes that are actually resistant to stains, that are actually prevent, maybe let's say you've got smelly feet, athlete feet. So you can actually have nanomaterials that can actually kill the smell from if you've got athlete feet. And then we also have some nanomaterials that are actually used in energy. Let's say for ESCOM, we have a problem with ESCOM. Actually, the problem that we have with the panels that we have, they're actually 20% efficient. So by applying nanotechnology to designing the new nano panels, which means that we can actually enhance the efficiency of actually taking energy from the sun. So let's say maybe we get a good panel, which can get about 40% efficiency. It means it's going to be expensive. But if we incorporate nanotechnology, we can actually reduce the cost, which means anybody being from rural area can actually be able to afford to have a panel on their roof and actually be able to do anything while there's load shedding. For today's presentation, I'm just going to focus in terms of nanomedicine, which is what we're focusing on today because we are part of health sciences. So here I've got a slide that shows the different nanomaterials that we're actually using for our research. So as you can see from the slide there, I know guys from pharmacy will know everything that is happening here. So we've got your lipid-based nanoparticles. So these are nanoparticles that are made from lipids. So the lipids can be any fat that's coming from other plants or even animals. So an example of a drug that is already on the market that is used for metastatic ovarian cancer is called Doxin, which is coming from Johnson & Johnson. So this is the first nanomaterial that has been approved for actually use in humans in 1995. And then the most recent one that is lipid-based, you remember guys, you had to take your COVID vaccine. So the COVID vaccine are actually incorporating nanomaterials, which is lipid-based. So what you have there from the example, you can see that the drug is actually in the core of the liposomes. And then the liposomes can actually be built from making the lipids, either from soybeans, even from eggs. So we're trying to actually use materials that are actually biocompatible to the body. So let's say we inject the patient with this thing, we want actually the drug to do its thing, and then the materials to actually be biodegradable within the body without causing any complications to the patients. And then the other nanoparticles that we focus on is your nanocrystals. I'm sure some of the guys who've got high cholesterol know about fenofibrate. So with fenofibrate, what you actually do is that you just take your drug and then you convert it into crystals, and then you just put some surfactants on the surface of that nanoparticle so that you can actually improve the solubility. So the advantage of using this type of nanotechnology is that sometimes we have drugs that actually taken orally by patients, sometimes they don't actually dissolve well within the body. So that's why sometimes you have to take multiple dosings of your medication. But with nanotechnology, you can actually help to enhance the efficacy of some of this medication and also the absorption. So sometimes I know during the emergence of HIV, do you remember during that time we have patients who have to take multiple drugs? So nowadays we've got fixed dose combination of drugs, which means you can take one drug instead of having multiple drugs. Or even for the ladies who are actually taking contraceptives, so remember you have to take a pill every day. Now there's an implant that you can actually put that can last up to 3 to 6 months. So which means with nanotechnology, you can actually improve how patients are actually compliant to any form of treatment that they're actually receiving. And then the other form of nanomaterials that we're using is polymer-based. With polymer-based, you're just actually having your polymer, and then you have your drug in the middle. So there I'm showing paclitaxel, which is actually used for breast cancer. And then I've got another example, which is your dendrimer. So with dendrimers, it's just a polymer, and then you get your drug to be on the surface of the polymer. So the advantage of using this type of technology is that you can make the system to be actually be responsive. Let's say, for instance, you take a medication, you don't want it to be degraded within the stomach. You want it to be actually absorbed within the small intestine because the pH varies. So which means we can actually deliver drugs that are actually sensitive to different conditions within your body. So sometimes you can even have your medicine be released at a specific time. So you can have a medication, let's say maybe we've got an implant, or maybe let's say you are a diabetic, you need to take your insulin at a certain time. So what you can do is that you can have maybe a timer that can actually release the drug within your body at a specific time interval. And then you've got your protein-based nanoparticles, which are just focusing on using protein to actually transport the drugs into your body. So there we've got your albumin, you can use different proteins to actually encapsulate your drugs. There you also have got a drug that is used in breast cancer. And then we've got your inorganic nanoparticles, which are normally used for bioimaging. Let's say, for instance, you're trying to treat cancer. So over time, it means you have to keep on imaging the patient to see how's the rate of the treatment. But with bioimaging, it means at the same time while you're treating the patient, you can actually see over time that the tumor is actually being destroyed. So this actually can help even with somebody in the rural area to actually be able to monitor the progression of the tumor that is being destroyed within the body. Okay, so here I'm just showing a slide of what is the market for nanomedicine. So those who are interested in getting into this field, you can see there's some key companies there. Let's say maybe somebody from pharmacy, but also the people who are also interested in water treatment. There's also a lot of companies that are actually looking for people who are specialists into nanotechnology. Let's say, for instance, you design a product that you want to purify water, maybe in some remote area, maybe in Brazil or in Central Africa, where people are exposed to cholera. Or remember also there was a time in Hammaskral where there was a complaint of people getting sick because of the contaminated water. So with nanotechnology, you can actually create products that anybody can use even within the comfort of their home to actually purify the water without actually what we've been doing in PE, like buying water at the shop every day. Because even for myself, I'm buying water because I don't know, I'm from Joburg, so the water tastes a little bit salty for me. So I can save money if I can have my own filtration system that I can actually design myself. So as I've mentioned, those are some of the companies for people who are in nanomedicine. Let's say you graduate, you've got your master's or PhD, you can apply for a job position at those companies. And also, I think the CSIR, there's MinTech, there's also a lot of opportunities at universities that are looking for people who are actually nanospecialists, because nowadays the universities are moving away from just basic theory research. They're now moving into a space of research to commercialization, which is something that our research group is actually trying to focus on. So this is highlighted on our next slide, which shows our research goal. It is moved from research to commercialization. So if you're somebody who wants to join our research group, you will come to us maybe with a research topic. Let's say maybe you want to go into water treatment, you want to improve, maybe create a product that anybody can use in a rural area. Maybe you want to go camping, and then you know there's normally some stream of water that has been running there that you want to purify the water so that you can actually drink it. Or maybe you know a medical complication that is existing that you see that no, there's no solution to actually that is affordable to everybody to use. You can come out to us with that idea. We can do some of the research, and then Next step is to disclose that information to the university so that they can start working on the IP. So everything that goes there from publication to even getting a full IP. So normally when you come to IP, most of the researchers, they own about 20 to 30% of the IP. And then most of the shares goes to the university, unless if you are self-funded, because most of the university are the ones who are actually assisting you guys with the resources, equipment, and also channeling the funds. But if you are self-funded, it means that you have more shares to your IP. So which means that even for us, we are actually open to entrepreneurs who are interested maybe into improving their product that is already in their mind, or something of a prototype that they want to actually improve before they can actually apply to TIA or even any form of international funding bodies that can actually promote their idea so that they can maybe start a spin-off or any startup company. So I'm sure you guys are aware nowadays that there's a lot of youth unemployment. So with our research group, we're trying to encourage people to start thinking as entrepreneurs, because you can see it's hard out there. There's a lot of people that close to 30% who've got degrees that are not employed. So better that you come to us prepared with an idea that once I graduate here, I know I'm gonna be self-independent. I won't be sending CVs, getting rejection. So yeah, that's the aim for our research group. So in terms of our current research projects, we're looking into artificial blood substitute or oxygen-based drug delivery. So as you guys know, there's always a call from the South African Blood Services that are looking for donors. Most people are not willing to donate. So our research is looking into designing some of this artificial blood substitute. And also you guys know we've got a high level of people living with HIV in South Africa. So which means we've got limited number of people who are actually willing to donate. And also the problem in South Africa is that we're not offering any form of incentive to donate blood. So which means people are not gonna will to donate. And then we're also looking into cancer therapy. I've given a couple of examples of different types of cancer therapeutics, which is therapy, tumor detection, even diagnostics. And then we're also looking into diabetes. Here we're looking into improving form of wound healing. I'm sure you guys are aware in terms of cancer patients, once you get an infection or a wound on your leg, sometimes it leads to amputation. So with our research, we're trying to create products that can actually reduce the number of people who can actually end up in hospitals because of chronic infections and sometimes leading to amputation of your leg. Another project that we're looking into is to infectious airborne diseases. You guys know we've been battling with TB in South Africa for a while. We're coming from COVID. We have to wear a mask every day. But nowadays, we've got nanomaterials that we can actually use to actually be cleaning the room without you intervening by using sanitizers or anything. And the other advantage I know during COVID, there was a company that actually produced a mask that actually self-sanitizes itself using nanotechnology, which means if there's a bacteria or a pathogen that is deposited on the surface of the mask, it can actually deactivate the virus, which means you don't have to keep on throwing the mask, contaminating the environment, or having to wash your mask. So there, I'm also giving you a slide of the different nanomaterials that we're using. And the other main advantage of this nanotechnology is that we're actually using indigenous knowledge of using medicinal plants that are actually normally used in Africa. So I'm sure you guys know that at least about 80% of people in Africa are still relying on traditional medicine. So we're taking advantage of that knowledge and incorporating them into nanomedicine. So for those of you guys who are interested in nanotechnology, we've got some couple of equipment that we're actually utilizing that we purchased in 2022 and 2023. You've got your UV, which normally use it to identify you've got your inorganic nanoparticles. We've got an automated nanoparticle system, which can actually automatically design your liposomes, even your polymers. We've got your DSC, which can normally use it for checking the thermal stability of your nanomaterials. We've got your IR, where you can check the interaction between your compounds with your polymers. We've got your light sizer, which can actually use it to check the phytochemical properties of your nanomaterials. You can check your size, you can check the stability. We also have got your electrosonic homogenizer, which can actually use it for cosmetic product development, even for solid lipid nanoparticles. So in terms of our research team, currently we've got Prof. Ru, who's our interim research chair. We also have Dr. Stephen Mfumadi, who's currently on leave. He's also our research chair. We've got myself, we've got Dr. Skuman, who's also part of our researcher. We've got Ms. Wisila Metula, who's our research technician. We've got Ms. Kosa, who's also a researcher and also our administrator. And then we've got Ms. Ogutle, who's our research assistant. At the moment, we're gonna get 2 more postdocs. At the moment, we've got 1 postdoc. We've got 12 MSc, we've got 6 PhDs. So that's just the layout of one of our labs that is based in Mission Valley. So we normally use this lab for analytical studies, but we've got also another lab for synthesis. So in terms of contacts, so that's our contact details. If you need access to the lab, you need advice developing a product. So we always here available. Okay, thank you.
Thank you so much, Dr. Mpo, for a very informative but complicated presentation. Someone coming from human movement science, so it's completely new for me. But as you said, people coming from pharmacy and even environmental health can maybe understand some of the information and they'll relate and they can maybe see possibilities, research possibilities with your team. Are there any questions from anyone on the floor? Even if you're not looking at collaborating, but any interest that you guys may have? Are there any questions online? Are you able to see? Just clapping. Okay, just for me, it's just a question out of interest because you mentioned very important innovations that have happened like with HIV and AIDS, where people used to take a number of tablets, but now they take 1. I recently heard that they are working on, I think probably using nanotechnology, working on a patch. So that's going to be slow releasing instead of people taking medication every day. Is that something that is happening? And do you perhaps know when we can expect to get that in the market? Just out of interest.
Normally for those type of technologies, they normally take a couple of years. It just depends when did they start that research, because normally to get a FDA approval, it can take about 10 years because you have to go through 3 clinical trials, which take about 6 years. So let's say maybe you a PhD student, so you've got your 3 years and then you've got 6 years to do clinical trials. So we're looking close about 10 years before you get a product.
It's a very long time.
Yeah, so
But
yeah.
necessary.
Yeah, it's
in order
just for
to make
safety
sure,
standard.
for
Yeah.
safety. Okay. No, thank you. That was just a question out of interest for myself. Are there any questions on the floor? Nothing. Okay.
Okay.
Oh, thank you
Thank
very
you.
much for your presentation.
Thank you.
Thank you. Okay, our 2 presenters are now here. So we will start with Ms. Murray, who is coming from the Transformation Office, that will be taking us through gender-based violence and safety for postgraduate students, which I think is an important topic. So over to you, Ms. Murray.
Good afternoon, everyone. My name is Yulita Mere. I am the GBV counselor at the Transformation Office. I would like to just hear from everybody, just find out from you, what do you already know about the Transformation Office, if you know it at all? Anybody, have you ever heard of the Transformation Office? And if you have, what do you already know about it? No one. Let's say now you are sexual. Oh, I can't take your hand. I'm sorry. Anyone from the floor? Let's say now. Oh, online, yes. I'm assuming that somebody on the computer will let me know. Let's say now you're being harassed or being violated by a supervisor as a student researcher. Where would you go? Who would you speak to? What processes would you follow? I mean, this is your supervisor, you know? Okay, the first one is go to the police station. What does everybody else say? What do you do? It's a female supervisor. What do you do? It's a male supervisor. What do you do? Okay, somebody saying box, guys. What would you do? Like, thinking realistically, what would be your initial reaction to the whole situation? Anyone? Okay, so that's what we are here for. We are called the Transformation Office. I'm not going to give a whole training about the different types of GBV that take place within the institution because of time. We don't have that amount of time, but I'm just going to give you information as to what we deal with. We deal with issues of discrimination, bullying within the institution. It doesn't matter who it is. It can be a lecturer, it can be your supervisor, it can be a student, it can be a fellow colleague, doesn't matter. We deal with those issues within the Transformation Office. We deal with issues of sexual violence. If you have any case, you want to report any case of sexual violence that has happened within the institution, you can come to our office, the Transformation Office, but that is not limited. We do offer support to even people who've experienced it from outside, but are still part of the institution. There is resources for those people to help them cope with the incident. So we also deal with issues of harassment and sexual harassment within the institution, where if you've experienced any form or some form of sexual harassment, you can come and report the matter to our office. Just to quickly hear from the floor, what do you think are some of the types of sexual harassment? I don't want to believe that you guys don't know the different forms of sexual, you at least know one. Yes. Okay, I'll come to you just now. Yes, ma'am. Inappropriate physical touching. Yes. And
Actually, that's what I wanted to add to. Actually, that's the point I wanted to raise
Okay,
of
okay.
being touched inappropriately.
mhm.
And then I know some now they even raise the issue of talking as well, how
Yes.
someone speak to you.
Verbal violence, there is that.
Yeah. And then I recently heard about the way someone looks at you as well.
Exactly.
Yeah.
Yeah.
So, yes, I don't remember
I would
that.
like just go to those where, yeah, definitely. But those are some of the things that are sometimes a bit shaky, or you get skeptical about them because you don't know, is it sexual harassment? Is it not? And that's the thing, that's the major challenge that we experience within the university, that a person will doubt the fact that they're experiencing something because they are not sure. Because some people will tell you, no, actually, this is how we do it in my culture. This is how I've been doing it all these years. Nobody has found anything wrong with it. And now you're stuck. Should I report? Should I not report? Because I might look or sound ridiculous. But the thing is, with the sexual harassment, it is subjective. It is what you, how you experience the whole situation, the whole incident. For instance, sir here might be comfortable with a touch on their hand, but ma'am here might not be. It's just how they receive the type of interaction. So it's really subjective. One of the staff members once said that it seems like everything currently is sexual harassment. And unfortunately, it is the case because of individuals. There's a lot of people, and each individual has their own experience and perception of what sexual harassment could be to them. So it's a matter of now respecting people's boundaries. And then it comes back to the issue of, have those boundaries then been communicated within those space? So that now challenges the individuals to be the ones who are able to tell a person, you know what, that is really making me uncomfortable. Let me ask you something. Now, you don't want to make situations awkward between you and your supervisor. What would you do if your supervisor just quickly, if, I'll give you that 1% for that, what you call cum laude, you get cum laude. If we can just go out one date. What do you say? You want that cum laude. What do you do? But you actually don't want it that way. What is that? Or what would you do? Now that is called quid pro quo. It's more transactional in nature, whereby now the person is asking you for something in exchange for something else. That's another form of sexual harassment that could take place within the institution, whereas you never have to give anybody anything of a sexual nature for marks, for accommodation, for admission within the institution, for funding, right? So yeah, so we had your touch, we had your verbal. What do you think verbal is? We've normalized making sexual jokes and making people uncomfortable, spreading rumors about a person that are of a sexual nature or just rumors about a person. Those are your verbals. Then you have non-verbals. What do you think that looks like? Because I think it's the most interesting one. How do you spot that, okay, this is harassment, sexual harassment? Yes, ma'am. Uh-huh.
Thank you. Like they're still flirting with you. You know, their normal voice is, Noluvo, you must do this and this. And now all of a sudden, Noluvo, you know, and that voice that just makes you so uncomfortable. I think that's what nonverbal is.
Definitely. It's the voice changes. It's the facial expressions. You know, you get those tongue licking facial expressions. You can tell that the person is not looking you at on the eye. They're looking at your chest area or your groin area. They're just basically making you uncomfortable. So your facial expressions, your body posture, how you're sitting can make somebody else uncomfortable. If you're sitting in a public area and you're just spreading your legs, opening them wide and touching your lower regions, you're making people uncomfortable. And sometimes it could be perceived as a form of sexual harassment. And then you have your electronic, which is your images, your written words, your video clips, your sound clips that are of a sexual nature. And then even emails, sending emails that are of a sexual nature, that could be a problem. SMSs, WhatsApps with little sexual innuendos here and there. That could be perceived as a form of sexual harassment, and a person can come to our office and report you. Obviously, that person will have to give their statement of their experience, and the person who's a respondent would also have to give their own account of the incident. Then they take it from, the office takes it from there. I think we'll give you a more detail on that. You can move on for you. Because of time, I don't want to go deep into it. These are some of the signs of sexual harassment. But remember, guys, it's not always the case. That's why I want to emphasize making boundaries clear and confrontation. Obviously, confrontation doesn't always mean we have to be physical and we have to be fighting and be argumentative about the whole situation. Let the person know that they've made you feel uncomfortable so that they don't repeat that behavior. So repeated compliments of a person's appearance could be a form of sexual harassment. Commenting on the attractiveness of other people, discussing one's sex life, asking one about their sex life, circulating nude photos or photos of naked people inappropriately, making sexual jokes, sending sexually suggestive text messages or emails, leaving unwanted gifts of a sexual or romantic nature, spreading sexual rumors about other people. So people would say that, it depends. Students will say to me that, okay, usually these things apply to ugly people. Do you get it? That people only perceive that it's sexual harassment when it's somebody that they don't find attractive. But on a normal, if it was somebody that they found attractive, that would be normal to them, which makes it a bit tricky because now we still go back to the fact that it is subjective. That's why I'd rather be safe than sorry. Just respect people's boundaries and constantly encourage communication, because it all boils down to communication. Because of time, I'm just going to skip right to the end. You can go. We were going to talk about rape. We don't have time to go through everything. We're just going to, no, we're going to go to the end, to the resources that are provided by the university. We hope that we could have a more in-depth training with regards to what our office offers. You can go back for your, go back. Okay, again. Yes. So in terms of supportive measures for people who would like to report GBV within our office, there's a link to the reporting page, or you can visit in NMU Transformation Office. It will take you straight to the link where you can log your complaint, or you can send Violeta an email, and then Violeta will assist you in terms of how you write down your statement and take all your information. For students, we have a GBV counselor which is myself, but for students with advanced or complex trauma, we have AIA, which is Alumni in Action. It's an initiative that is sponsored by Bolo World. It is run through our office, where students get 8 free counseling sessions, and they're paid for by Alumni in Action. And then for staff members, there is free counseling, wellness at work. Once again, Mtonjeni is also there for the students as well. We have female and male GBV support groups, LGBTQI plus community support groups, as well as medical treatment advice at student health for students. Staff members, they will have to speak to their own private practitioners, medical practitioners. So we also have specialized training on GBV ongoing. Every Wednesday, we try to produce discussions around GBV matters for students to be informed, and staff members as well. We have self-defense classes, which are for free. If perhaps you guys, the organizers, would like to organize that, our instructor would be happy to come here. And then we also have a first responders guide course on how to support people who've been survivors of trauma without re-traumatizing and victimizing them. And then we have take responsibility for your safety. We do have booklets with safety tips on campus, because we do get a lot of the incidences on campus. And also we also encourage the reporting of unwanted behavior. So other protective measures, there's leave of absence for staff members and students, no contact order, which is issued through the university's legal services, but you're still more than welcome to go outside and get a protection order for yourself if you want to. Like the gentleman said here that he would go to the police. That option is also open. Even if you have the case outside, you can still come into the university and open another case. You can have a case here and have one with the police as well. You can do that. And then change of university residences in the case of students. Sometimes students do not like to remain in the same environment where the incident has happened. So therefore, we would try to assist them in relocating, or the alleged perpetrator would then be relocated as well. There's also academic concessions or change of classes for students as well. In your case, you would also get the same as your students. And then these outside resources that we like to just give to our students, but you'll find them in the pamphlet that we will hand out just now. That's it on my side. We hope the organizers can organize a more in-depth training from our office. That would be great. Thank you.
Good afternoon, everyone. My name is Vuyong Ofe. I am from the Transformation Office. I am the case coordinator. I'm also doing LGBTQI plus advocacy coordinator. So within the office, we do have what we call Mandela Pride as part of the portfolios within the Transformation Office. But I do want to get to understand also, as my colleague did in the beginning of their presentation, what is the first thing that comes to mind when someone says pride? First thing that comes to mind, pride. No one. When someone says LGBTQIA+. Okay, let's just maybe wait for the microphone so that we can assist those who are online. Thank you for trying.
I'm saying I'm not sure,
Sure.
but non-binary.
Non-binary, thank you. Non-binary is important. I'll explain why it is. Do we have someone else? What comes to mind when somebody says, I am part of the queer community? Do we have a hand? Okay, there's a hand at the back. Thank you.
Safety.
comes to mind.
Safety. Thank you so much for that. It's the first time I'm hearing someone taking a different approach, but thank you. Thank you.
Respecting people's sexual orientation.
Thank you so much. We are talking about people's sexual orientation and preference as well. I liked what you said, the previous speaker about safety, because queer people are not safe. If we're talking about hate crime, queer people are being killed for being gay, for being bisexual, for being lesbian, for being trans, right? They live the realities of the queer people. Also within the university space, you would find that a lot of people are being bullied by classmates in WhatsApp groups. I'm sure you guys might have a WhatsApp group, or by even their supervisors. You get bullied just because they know that you are gay. And within our office, you can open a complaint of discrimination based on your sexual orientation or based on your gender identity. So speaking about gender identity, this is a gender-bread person, right? I'll try to be brief as well. This is a gender-bread person. We talk about identity, gender identity, and how that is different from sex, right? And sex here is what you have in between your legs, right? It is what you were assigned at birth. We're talking about sex and not the other sex like umdavas, but this sex, right? So sex is what you were assigned at birth. Because you have a vagina, and then the doctors would say, Papa, it's a girl. They're assigning you because of what you have. And because you have a penis, and the doctor will say, it's a boy, right? And what happens if you've got both? You guys have never heard of someone born with both a vagina and a penis. You have. I do want us to get the mic here as well, and as well. We'll give you just yes. Sure.
I forgot the term that they use, but I have heard of it, and that it's rare cases. And I've heard of females as well who are born with male testicular organs inside of them, and most of them, it affects them while they are in puberty.
Yes,
Yeah.
yes.
So we would find a female having um tons of testosterone and
Mm.
having male features, and then they would have to go to the doctor, and once the doctor does the test and everything, then they find that it's either they have the testicular torsion inside of them. So it's something that I've heard, and I've seen that it's not a lot of people in the world that have it, but yeah.
There's someone who knows exactly what is that. You have an answer for me, please. Thank you.
Intersex.
Intersex. Thank you so much. So when we talk about sex, we're talking about female, male, and intersex. And most of the time, it is not that it will be that the vagina is visible and the penis is visible, as the colleague was saying over there, that sometimes you are born with a vagina, and when you're getting to puberty, you ask yourself, why isn't that I'm not growing boobs, and why is it that I'm not going to my periods? And when you go and check to the doctor, they will tell you that you have you are intersex, or you have testosterone, high levels of testosterone in your body. We've seen so many cases. Caster Semenya, are you guys following Caster? You guys know about Caster? Outside of them being intersex, they're great athletes, right? They're great. And that's what we talk about when we talk about sex. It's what you have in between your legs. And sexual orientation is who you are attracted to. It's about attraction. I always say, simple terms, matters of the heart. Matters of the heart. It's who you are attracted to. That is sexual orientation. Gender expression is how you express your gender. Maybe in the way you talk, the way you walk, and the things that you wear, that is how you express your gender. But now, gender identity. I want to get to, do you guys understand anything about transgender people before I sit down? Trans people. Oh yeah, I'm hearing voices. Do we have any comments online? Trans people? Nothing. All right. Nothing. So as a trans person, right? You are born with a vagina, right? But your gender identity, how you see yourself, how you feel about yourself, does not align with the sex that was assigned to you at birth. I want to make a very practical example. I was born female with a vagina, right? But I don't identify as a girl or as a woman, right? You can socially transition by just coming out as trans. I mean, to your friends, if you want to come out as trans, transgender male, trans boy, you know. You can also medically transition. What does that mean? You get to go through the process of taking hormone, right? There's for trans men, there's what you call testosterone. Yeah, you go to the doctor, you see a psychologist, then they give you testosterone. You can legally transition as well by changing your ID. And here at Nelson Mandela University, we've got a third gender marker. So if you go to your student portal, if it's written Miss Violet Ngove, you can change it to MX Violet Ngove, right? Which is gender neutral. Someone mentioned gender non-binary. Gender non-binary is people who do not conform to either the boxes or to the binaries of being female or male, right? And most of the time, their pronouns are they, them. Are we together? We've seen a lot of them. So transgender people, it's a person whose gender identity, how they see themselves, how they feel about themselves, does not align with the sex that was assigned to them at birth, right? There's what we call lesbians. Do you understand what lesbians are? Do you want to try? What is a lesbian? Who is a lesbian? Do I look like a lesbian? Sorry, you can go ahead.
I'm not sure. So, what I understand is that a lesbian, I think, is a female who identifies as a female and whose sexual partner is a female.
Thank you for trying. So a lesbian is a woman that is emotionally, physically, and sexually attracted to other women. Why I'm very worried about using the term female, because female is what you were born with, and not all women have vaginas. There's also trans women, and they are women, and they also can date women. They can also be in a lesbian relationship. So a lesbian is a woman who is emotionally, sexually, and physically attracted to other women. Also gays. Gay is a man who is emotionally, physically, and sexually attracted to other males. LGBT, and the B stands for bisexual, right? And LGBT, I just explained transgender, someone whose gender identity will identifies as a man, but born with a vagina, right? Does not align with the sex assigned to them at birth. LGBTI, intersex, we talked about it, right? LGBTQI, the Q stands for queer, which is an umbrella term to identify as LGBTQIA plus. In our days, we just come and say, hi, you letter, I'm queer, nice to see you. Well, we don't have to say that when you meet someone. But it's an umbrella term. And also, the Q can also stand for questioning, right? So it's a stage where you are also reassessing your sexual orientation, your gender identity. That is it's the most difficult stage, because people then label you. They say you are confused when today you are working with Yulita, tomorrow you're working with Sipo, that other day you're working with, they say you are confused. And it's okay to question your own sexual orientation and to question your own gender identity. LGBTQIA plus, what does the plus stands for? It stands for all other sexual orientations and gender identities that are not mentioned in the acronym. So you don't have to actually get it right. I see a lot of people, program directors struggling. I want to get it right, LGBTQIZ, but plus, you can just say LGBT plus, LGBT, LGB plus, because the plus represents all others that are not mentioned in the acronym, right? But we are here to say Nelson Mandela University is a safe space for everyone, regardless of your sexual orientation, gender identity. We do have conversations, we do have dialogues. So if you're interested to talk about gender, if your studies want to touch on gender, I heard this is a science, these are science people, right? Health sciences, we could find something gender identity there, sexual orientation there. You want to understand hormones, how does it work? And we could come up with research topics, right, that might be linked to gender studies. And we would be happy, even if it's not something that you are studying about, but if it's something that you are interested in, conversations that you want to be part of, you are more than welcome to come through and be part of the community. We call ourselves the queer community, and allies. Allies are people who support the queer community. We need allies, especially in the university sector. We do have a queer support group. We do have queer conversations. We do have a podcast. We do hold Emerge and Pride parades. We recently had a conversation about the Transgender Day of Visibility, which was on the 31st of March. We will be having more conversations on International Pride Month in June. And as Nelson Mandela University, we celebrate Pride Month in October, because October is South African Pride Month. The first ever gay Pride march or parade was done on the 13th of October, 1990, by people like Simon Coley and Bev Datesy, who led that march. And I think that is why we're here, to say, be part of the community. And also, can we also be aware of people's pronouns, right? Even if I was talking to Yulita today, tomorrow I must always be aware that I can ask someone's people their pronouns, right? How do you do that? Hi, my name is Vuyo. My pronouns are they, them, he, him, she, her. Can you tell me yours? And they will. If you happen to misgender someone, do not panic or do anything like that. Please do apologize and ask their pronouns. And we are trying to stay away from the correct pronouns. There's no correct and wrong pronouns. These are my pronouns, right? So it's quite important that you ask each other, what are your pronouns? How do you want me to refer to you? By asking pronouns, you're not asking anything like, can I ask, are you a lesbian? Pronouns have nothing to do with who you sleep with at night, right? You're just asking, how do you want to engage with them? Whether in class, via emails, or in group discussions. I want to check if there are any questions.
Any questions on the floor or online?
There's one question. Thank you.
Okay, thank you. But then my question is actually for Miss Murray. I think it's a transformation office. Just that we didn't get a chance to ask question, then you jumped in, so I had this question. So now, on that transformation office, you mentioned that if one find out they are violated, they can come and report to your office. So I'm interested to know, what is it that you're gonna do? Is there consequences that the perpetrator will face? Are you able to impose consequences to that perpetrator? I'm interested to know what you're gonna do.
Yeah.
And then number two, if this incident happened outside the campus, are you able to entertain such? Let's say something that happened outside, didn't happen inside the campus, it happened somewhere in Boardwalk Mall, but it was someone that works within the institution, and I'm also part of the institution. Are you able to entertain that, or you only entertain matters that only occurred within the campus? And then third one, last one, in terms of, you also mentioned the issue of saying you do offer defense skills.
Yes.
Yeah, but it was for women. It says
No.
defense skill for, okay. I saw it
Okay.
in brackets, says women.
Okay.
So
We
to me, I
usually,
was-
sorry to cut you off. We usually encourage women to attend it, but it is actually open to everyone within the institution, both staff and students. Last year, we had classes at Sports Center, but there was poor uptake. But we usually just give more attention to women most of the time, but it is open to everybody. There will be a memo going out inviting all staff and students. And in terms of the issue of outside and within the institution, if the person is within the institution, they will still go through the same process. You can report them. And then the process is like this. What you do is you come to the office, then you get an opportunity to write down your statement of what had happened on that a day of that incident. And then you log into the online system. That's when now you get contacted by the investigator. You get contacted by the investigator, then you are referred for counseling as well to, I'm not sure if, I think it would probably be student counseling with me or wellness at work, depending on who it is, whether it's a staff or student. And then after that, the perpetrator, alleged perpetrator, we like to say that because at this point, they haven't been proven that they're likely to have done this, right? So they're also contacted by the investigator to check and investigate if this really happened. Vuyo can explain it better because Vuyo is the case coordinator of connecting people with the different resources in terms of the complaints process. But afterwards, then it can either go for disciplinary hearing, whereby there's a panel in there, and then there's yourself with your representative, because you'll be represented by the university as a complainant, and then the respondent might have their own representative as well, or sometimes they choose to represent themselves. Or it can either go for mediation, where now the university will appoint a mediator to mediate between the two of you. But you also have a say in what you would like to see happen within the case. Sometimes you'd find that people would rather just go the route of mediation, especially for cases of harassment or things that they feel like, okay, had they had a conversation about it, they could have been cleared out. So they would rather go for mediation. So that's how it goes. And most people would ask me, then how do you prove that this person is guilty? That is why the investigator is there. Would you like to take that? Okay, but the outside part, where if it's a person it might have happened outside, but if it's a person within the institution, that you can still report. There is measures that will be taken to support you in that regard as well. I hope I answered your question, but we will touch on the process.
Thank you so much for that question. So as Yulita has said, the process starts with us lodging the complaint. So we need your statement, right? Telling us what happened. In the statement, we also need to understand that we have, for GBV cases, we have a policy called sexual harassment and sexual offenses policy that provides two options for you. The first one is mediation, Yulita said. The second one is formal disciplinary process, which includes DC hearings. So in your statement, right at the end, we must understand what is the relief that you are seeking. Let's say in this case, you want DC, disciplinary process. So we lodged the complaint. We've got two investigators, two internal investigators, Advocate Somia and Dr. Rachel Chasakara. So I refer then the statement to them. If you've got witnesses, that second stage is called the investigation stage, where everyone will be investigated. Your version of the story will be heard. The version of the alleged perpetrator and your witnesses and their witnesses will be heard. If there are CCTV footages, voice notes, screenshots, they form part of that. Yes, and witnesses. So once that is done, we don't have a docket within our office. We have what we call an investigation report. We provide a report of the investigation, right? There's now another stage called the inquiry panel, which is there to make deliberations and recommendations based on what the investigators' findings were, right? So what do they look at? They look at, okay, we do have a prima facie case here. There are grounds for sexual harassment. So in this case, yes, this case can now be sent to a legal services office, because in our office, the sanctioning does not sit within our ambit. We facilitate the process. The sanctioning of alleged perpetrators sit by the offices of the legal services office for students, right? So once we send now two reports, the investigation report and the recommendations of the inquiry panel. They go straight to the Legal Services Office. No investigations will be done there. They just need to facilitate a DC hearing with a panel, another panel now. So everyone will be called in, their versions of the people will be heard, and if the panel finds the person guilty, the person will be given sanctions. Again, Legal Services Office, they have their own policy in terms of, for example, for rape within the institution, it's expulsion. You are expelled with immediate effect. Right. And even for sexual harassment, we have seen people being suspended with immediate effect. For harassment, it differs. It differs with each sanction or with each misconduct or with each charge that you're facing, right? So that's how the process goes. It starts with us, but the sanctioning sits within the Legal Services Office. But if it's a staff member that committed the crime, then the Employee Relations Office is the one that now facilitates the DC hearings. We also sit in those proceedings, but Yulita as a counselor, I'm a case coordinator. We are sitting now there as support persons to the complainant, because now remember, you have to retell your story and it could be quite traumatizing and triggering. So we're there to provide support. And also again, to touch on the jurisdiction part. If you guys are both Nelson Mandela students, you went to Bieshek, White Tiger, Cubana, and something happened there, the person can still come and report you to the university because you are still a registered student. When it becomes a problem is that when you deregister or when you resign as a staff member, then as the university, we no longer have jurisdiction then against that person. This is why a lot of cases where students are facing charges, let's say, for example, of rape, before even it gets to the DC, a person will deregister from the university because in their academic record, it will not reflect that they were guilty. Until it gets to ETC and you are found guilty of rape, then the panel does say that your academic record will be endorsed, right? Even for sexual harassment. So people, they run away from facing the consequences, which is now having to face the sanction. But some, they do stay. If you do stay until the end of the process, you are found guilty, your academic record will be endorsed, and that will be reflected on your academic record as well.
But I also want to just add that if you're a staff member and there's the case pending against you and then you leave, that will still be reflecting that there is a pending case. Obviously, there is no outcome or sanction on that, but it will reflect that there was a case pending when you had left. So that is also on that. And sometimes we would have staff members, maybe a supervisor, just to make an example that's more practical to you guys. They would say they were in a consensual relationship with a student. So they did nothing wrong. That's where now the policy comes in, the sexual harassment and offenses policy comes in. Students and staff members are not allowed to be in those types of romantic relationships. And if they are, the staff member has to disclose it to the university. I think HR, they have to disclose that relationship or to their line manager, because sometimes they'll be like, actually, I did nothing wrong because we're in a consensual relationship, but nobody knew about it. So yeah. I hope that answers your questions.
Okay, thank you very much to Yuleta and Vuyo. I really enjoyed the presentation. I think because of time, we unfortunately cannot take any more questions on the floor because our next speaker is already here. But thank you very much. And if anyone has any further questions, they can reach out to the Transformation Office. I'm not sure if all the presentations will be shared with the participants. Yes, okay, so all the presentations will be shared and hopefully the presentations have contact details for people who may want to contact you after today. So thank you very much for the presentation. And then for our next speaker, we have Dr. Noluvo Hangana, who is the manager at the Assessment and Graduation Office. And she will be taking us through the postgraduate examination process, which is a very exciting but also nerve-wracking process. So she'll take us through that so that you at least know what to look forward to after you've completed your M or your D. Thank you.
Is it on now? Okay. Good afternoon, everyone. My name is Dr. Nolu Vohangana. I am not the manager, Doc. I am here with my colleague, Ms. Yamgela Ndagayi, and my boss, who is the manager, Ms. Varda Mohammed. We're coming from the Assessment and Graduations Office. And so this afternoon, we're here to talk to you about the process now that you're done with your research. By the time you get to our office, you would have lost a lot of sleep. You would have lost a lot of weight because of stress. You would have gained weight. If you're like me, you stress it. You would have lost a lot of hair and all that. And by this time, you just want to yeah. So by this time, you just want to submit the research because you have gone through all the emotions. You were happy at some point. You were disappointed at some point. You were scared at some point. You were frustrated. Now you're excited. You're done. You just want to just get it out of your hands. So now you come across myself, whereby you now have to submit your research. So firstly, what I want to say is now you have done your research. Very important, your document must be in a PDF format, okay? It must be in a PDF format, and you need to just ensure that you have the correct title. Understandably, that the title can change from the start of the research to when you are now done. If that is the case, then we need to have all the documents from your faculty. Okay, and also you now need to submit to us permission from your supervisor. Your supervisor is saying now you can submit to exams. We need to have a signed permission to submit from your supervisor. Now with this one, your supervisor can say, I agree that you submit this work to exams, and they sign. They can also say, I feel that this work is not ready for examination, but they must also still sign, even if that is the case, okay? So when you are submitting to us, we need to have that documentation so that we will be able to process your submission. Just to take note, and this, from my experience, this has been evident in the health science faculty. Your research, if your research is not classified as a confidential research, and you will know this because your supervisor will share this with you. If it is, then you can have research is subject to confidentiality agreement on your cover. But if your research was approved as not a confidential research, then please do not have that on your front cover because that can be very misleading. Okay? Then, very important, when you are submitting to us, you need to have as the subject of that email, because remember, you're not going to take a hard copy to exams. You are going to submit your research via email, okay? So you will not have to go and print and submit to us a book, and no, you will submit your research via email. Very important, in that email, on the subject there, please have hashtag, as in the hashtag icon, assess_health, your surname, initial, and student number. It might seem as something that is not important now that I'm saying it, but believe me, it is very important because that subject determines where your submission goes. We have a postgraduate mailbox. If you do not have that on your subject line, it goes to the general postgraduate mailbox. Now you can imagine it's submission time. A lot of students are submitting, and you are sending your research to the general mailbox. By the time we get to it, we would have sent out the ones that you submitted with, but submitted correctly. So it is very important, very, very important that you take note of the subject of your email, okay? Then for the PhDs, when you are submitting your PhD, please also submit a 100-word citation to us, and also submit an article manuscript to your supervisor 6 weeks after you have submitted for examination. If you're submitting for your master's, just your research will be fine, okay? And then again, I emphasize on the research is subject to a confidentiality agreement because that causes complications along the line. So now what happens after you have sent your research to us? If you're doing masters, examiners are given 4 weeks to examine master's dissertation. Okay? The doctoral thesis, the examiners are given 6 weeks. And we're sharing these timelines so that you know what to expect and so that you can manage your expectations as well. Then in the process now, you have submitted to us, the examiners have assessed your research, the reports are get sent back to me. And I take those reports and I send them to your faculty. So I'm not expecting you to call me after 4 weeks and say, did I pass? Did I fail? What's happening? I need my results. Because I am not allowed to give you your results. Your reports will go to your faculty. Your faculty will approve the reports. And then the faculty manager is the one who's going to inform you of the outcome. And there has been instances where students, they're demanding of their results. The exams office cannot tell you if it was a pass or if it was a fail or what the case is. We are not allowed to do that. Okay? Now you were successful from your research, the degree is awarded, and everything is fine, everyone is happy, you're happy, supervisor's happy, everyone is fine. Now what must happen next? You will then submit to us again. But this time, you are not submitting to us for assessment, but you are submitting to us a final copy of your research so that we can now process you for graduation and so that your research can go to the library. Okay? Very important, you need to submit that final copy. If you do not submit that final copy, you will not graduate. Okay? You are successful with your research, you know that you received a pass, but if we don't have that final copy, you're not crossing the stage, that's non-negotiable. Okay? If now your reports come back and you did not pass, you need to resubmit. What happens then? Now, there are timelines with regards to that as well. If you're doing your master's and you did not receive a pass, then the university, you are given 3 months to go and work on your research again, submit again, so that you can try again. Take note, it's 3 months for masters, okay? For PhDs, you are given 6 months to be able to do your corrections and then submit again to us, okay? Now, I spoke about the second submission. Now you have received your results, you passed, everything is fine. You need to submit to us now your final copies. Now, again, if you forget anything that I say in this presentation, just remember subject line, because that is very important. Now you are submitting your final copies. So now on your subject line, you don't say hashtag assess because you have already been assessed. Now say hashtag final, because now this is a final copy. Okay, you submit to us your final copy. The second thing there just basically says that you need to submit in order for you to graduate. It is a rule, so it's not something that I just thought up, okay? Then after you have submitted your final copy, your supervisor will have a look at your final copy. Your supervisor again has to say you can submit. So again, it's very important that you have that permission to submit final copies from your supervisor, because we need to see that the supervisor is in agreement with what you are submitting to us. Okay? Now, after you have submitted your final copies, you can then get ready to graduate and you are done with our office. We will celebrate you at the graduation, and that concludes my presentation. For this faculty, I am the contact person. We normally do send an email with all the information that I've just shared with you closer to the submission time. We share the same information that I shared. Please do read that email. It will have all the documents that I spoke about, the permission to submit that your supervisor must sign. It will be an attachment to that email from our office. Also, In that email, there will be templates as to how your cover page must be and all those things. So we do send the information via email. Memo, I know research, you're very busy, you do not have time to read memo, but please, if it's memo, it's saying assessment and graduation, please read the email, because it will also help us in terms of processing your submission to us timelessly. If you have questions, if there's something that you are not sure about, my name is Nolu Vohangana. You can send me an email, you can call me. I will be able to answer all your questions. Also, this presentation, I'm hoping that it will be shared, because there's a link there that also has these documents that I'm talking about. Maybe a supervisor will be like, give me this thing that you want me to sign for permission to submit. You are able then to send it to your supervisor. Okay, that concludes my presentation, Doc. Thank you so much.
Thank you so much, Dr. Kangana. Thank you so much. Are there any questions on the floor? Okay. Or comments?
Thank you so much, Dr. Hangana. You mentioned something regarding a student who's submitting maybe without endorsement from the supervisor. Just for maybe a student, what are the implications of taking that route if you forced to submit without your supervisor's approval?
Okay, that is a tricky one. I feel like you're putting me on the spot. Look, I cannot tell you as a student what decision to make. But what I can say is that when we are sending off your work, we do not send the permission to submit document to the examiner. Okay? Because if the examiner sees that and then the examiner sees that the supervisor was not okay with this, already that creates bias in terms of the examiner. So we send your work still to be assessed. However, the faculty will have a record that especially in terms of masters, let me first explain it like that. With masters, we will still send your work, we will still send your reports to your faculty, and that will not perhaps maybe disadvantage you in terms of that. However, in my personal capacity, I always encourage that the student and the supervisor come to some sort of, agreement. With a PhD, when you submit your PhD to us, your supervisor writes a supervisory report. So that report, your supervisor documents your journey in terms of the research, what the research has to contribute to knowledge and all that. We do not send that report to the examiners. So your examiners only receive your work. They only assess your work based on what you have submitted. However, when we are sending those reports to the faculty, we also send the supervision report to the faculty so that when they are deliberating and approving your reports, they have an idea as to what has happened. So my personal advice, rather reach an agreement with your supervisor before you submit. However, I have to tell you that because it is your right as a student to know what your options are. I hope I answered your question. Does my boss maybe want to add something?
The question was answered sufficiently, thank you. But you are able to submit without the permission of your supervisor. The permission form requires them to either sign off as I permit the student submits for examination, or they can give permission with reservations, or they do not allow the student, or they do not give permission for the student to submit. If the assessment process continues as usual, it goes out to the examiners, as Dr. Ranhana has indicated. That information is not shared with the examiners who assess the dissertation or the thesis. However, if it does come back as a positive, the supervisor will still need to sign off when you hand in your final copies. So if the supervisor is willing to then sign off and give permission for you to submit your final copies in order to be linked for graduation, that would be okay. If the supervisor does not want to sign off on the final copy, then we usually approach the Faculty Postgraduate Studies Committee to then look at the submission of the final copy, and then they would sign off on the submission of the final copy in order for the student to graduate. Thanks.
Good afternoon, everyone. I just want to add Dr. Hangana, because I think this is something that we've come across quite a few times. Ne? Can we also add that if, let's say, your due date is December, your submission due date is December the 8th, please do understand that there might be people that might have submitted on the 7th, on the 6th, like days before the 8th. So can you also please do then check up on Dr. Hangana, maybe after a week you've submitted, to just check if she has received it and if she has attended to it. Because some of the issues that we find is that a student would submit today and expect that their submission is sent for examination the very same day. So please also do check up on Dr. Hangana. I know that she does reply to her emails and she'll definitely take your call. So I just wanted to add that as well to what Dr. Hangana was presenting today. Thank you.
Thank you very much. Are there any more questions? Do you have questions online? All right.
Yeah, thank you for the presentation. I just wanted to ask if NMU allows students to submit by publication instead of the traditional thesis.
I think, Doc,
So this is my personal experience. I know, and Prof can also attest to this, that we currently don't have a policy at the university that stipulates how you submit via publication. However, the policy does say that you can use the discretion of the student and the supervisors. So in my case, I wanted to submit my PhD via publication, not the traditional way. And it was a process that we had to go through with my supervisors. But now the only problem is that since you don't know how many publications you need, is it like 1 published, 2 submitted or accepted? Like there's no stipulated requirements what is necessary. So for myself, because I wanted to publish a number of articles, I tried to at least have 2 published and then 1 that was accepted or was submitted. But there's no set guidelines, unfortunately, but from myself and 2 colleagues in my department, they did it successfully. So I think it's a conversation you need to have with your supervisor and yeah, see how to work around it. But it is possible.
thank you, Doc.
Do you want-
Oh,
Yeah, thank you so much. She's actually well captured it. However, I just want to probably mention that there is a difference with submitting via manuscripts and articles, because you might have the dissertation or thesis in manuscripts, not published. We do know that at times it takes a bit of time for journals to publish and all that. So it may be unfair as well on the student. However, it is done, and if you start on time, like Dongwenisa mentioned, and you and your supervisor or promoter planned it accordingly, you could still have your publications ready for your dissertation or your thesis. Thank you.
thank you, Prof.
Okay, any other questions? Let me just quickly check if there's anything online. It doesn't seem like we have any questions online. Thank you so much, Dr. Hangana. That was a very informative presentation. I think we've now come to the end of the session, and I will just hand over to Prof. Maleriri to thank everyone and then maybe give information about tomorrow's session.
So much, please, a big hand of applause to our chair for the session and to all our previous chairs of the various sessions in absentia. Very much really appreciate all your input. It's really exciting to see the commitment and the zeal with which you have shared the sessions and made it quite lively. Thank you so much. And it wouldn't have been actually fruitful if you are not here. If you have exited the hall after 1 o'clock, we wouldn't have continued. So a big clap to yourself, both the on-site and online delegates. Thank you so much for your patience. I'm very much aware that it's not easy to sit in a place all through the day trying to, get all that is being said. But I promise you, it's something that you would actually appreciate as you go along, that you've been here today. And tomorrow we have a very important presentation that you don't want to miss, especially for those of you that are yet to submit your proposal. In the first session, we have writing up the literature background and problem statement, even introduction to research proposal. Please do not miss this session. Try to be here on time. And we are also going to be welcomed by our distinguished professor, Professor Trute, who is the director, School of Medicine and Clinical Sciences. And we have, after the tea, Mio's training session. I know Mios was mentioned when Tembeka was presenting something, Mandela Ethics Online System. You have to submit your proposals via that system. So please be here to have an insight on how you can navigate via that. And we'll also have the REC-A overview. I know you asked a question on all these acronyms, abbreviations, REC-H, REC-A. REC-A stands for Research Ethics Committee, animals. The A is for animals. And REC-H is Research Ethics Committee, humans. So you're going to be also getting introduction on the REC-A from Professor Trute. Really, a kind of, if you look through, you will see that after lunch, we expect that you would have received some more energy. And then we spoke about systematic review earlier on. There's also scoping review. So please, we cannot overemphasize this. Please be around, even if you don't want to do a scoping review or a systematic review. I promise you what you would gain via being in those sessions would help you to make your literature review a worthwhile chapter. So please advise your colleagues to also be in attendance, those that are not here today. We will also have planning your research journey timelines and budgeting. Ms. Tracy Hutton, who is also the coordinator of this particular PG program. I really want to say thank you. She was online in the morning session. And we will also have a session that will be facilitated by Professor Soji, the director of School of Behavioral and Lifestyle Sciences. And this is actually trying to let you know how to respond to reviewers' feedback. Someone said something during the presentation. When you receive all those feedbacks, you turn around the pages, they're all read. You can actually, at times you feel like closing it and just going to sleep. And you stay maybe 2 months, you don't want to open it up. Listen, it's not actually meant to get you angry. Those comments are designed to ensure that you do not receive it from examiners, because any of such comments you receive from examiners means a minus for you, and it brings down your score and all that. So please, when you see those comments, appreciate it that you're able to receive these comments so that you can actually already answer the questions that examiners would have been asking, which when they ask is like, okay, I'm removing this. So please, let's note that, because more often than not, you see students while doing the rebuttal on responses to the reviewers or examiners, you see them trying to fight back, or maybe to say, why must you do this? So this actually is a session that will show you how to respond. Okay. Then we would also have, it's very interesting to know that, so please let's not disappoint our faculties. We have Professor C. Yoni, who is going to be doing systematic review. He's a professor from the University of Free State. So please, let's actually be in attendance and get all this that's been designed to enable us excel. I just want to quickly mention one more thing. I do know that there was a discussion, or maybe it was just mentioned in passing, regarding having cum laude and maybe you doing excellently well in your master's, especially because for PhD, they don't write cum laude for PhDs, but the scores are there. I just want to also mention, please note that if you are extending your studies, you might get that score, but it won't be written cum laude. If you extend your studies beyond the maximum duration, if, for instance, you're doing a full-time program and you are a master's student, I think it's 3 years, then become a right. So if you extend your studies and you now have 4 years instead of 3 years, even if you scored 95, it won't be a cum laude because we are trying not to be biased because they want to rate you with others that finish the program at the same time. Okay, so if you have taken an additional time, it does not great for us. I just want to mention that because I know there were cases or maybe instances where people have queried, I got this score, why is it not a cum laude? So please let's note that at this juncture. Thank you so much for coming around. Without really wasting much time again, I'd like to say please thank you and keep well, enjoy the rest of the evening and see you again tomorrow as we continue the day 2 session. Thank you and God bless you.